Hello everyone, I am Yağmur Harputlu Yamak. I am a specialist. I will be talking about psychosocial interventions in digital addictions. My structure of presentation is like that. It is actually an addiction related to the digital portal usage like internet, video game, and social media and smartphones. There are a lot of addictions that could be included into this structure. When we check out as diagnostic in DSM-5, internet and gaming addictions are included into DSM-5 in diagnostic stage, and YCD-11 also officially recognized gaming disorder, but we don't have the exact diagnostic definition about this. Of course, digital addiction is not only about the screen time, it has many effects, and the intervention methods are critical in neurobiological consequences, academic and cognitive disruptions, emotional and behavioral outcomes are existent. And here, actually, digital addictions are not about individual factors. It has environmental factors, and we have theoretical models in this slide. As you can see, there are a lot of theoretical models actually, but here I will be focusing on the theoretical model that is defining the digital addictions. And here we have cognitive behavioral model, PS model. It's not about understanding the digital addiction. It is about creation of the individual intervention plan creation. So individual formulation should be made and target based intervention program should be created. Psychosocial interventions has CBT approach is coming to front, and again CBT-based interventions, family, school group-based interventions, digital-based interventions, and other interventions will be touching up little by little each one of them. Cognitive behavioral therapy is based on the cognitive behavioral model, and which holds that thoughts determine feelings and thus changing one's thoughts. While Davis has a cognitive behavioral therapy model, internet adaptations are actually emphasized with online portal usage. Here we are focusing on cognitive restructuring, and digital usage shouldn't be cut altogether. There's supposed to be a healthy usage plan created, and cognitive model is shown in detail there. The individuals distal factors are shown: psychopathology, social anxiety and depression, low self-esteem and early age, traumatic existence, and these kind of factors could be a trigger like a stressor can cause this kind of digital experience. So there is an enhancement loop going on. A brief relief situation could transform into compulsive behavior. There are proximal factors that has no function. Thoughts that has no function are coming to the surface at that period of time. I will be talking about the gaming side, like I am valuable in gaming, so I'm not valuable outside gaming kind of thoughts going on. When we see that the 12 session treatment plan is mostly organized and monetization afterwards, this monetization process changing the behavior will be the main focus. The environmental factors defined and cognition interventions will be conducted. There could be some challenges, low motivation, especially in children and adolescents. We see that often because the adults and parents actually conduct intervention with an application to our party, so they don't have treatment motivation. In that condition, we have to use related methods. Psychoeducational parent training sessions should be planned as well. It's very important in the process. Comorbidities, recoveries also could ease the process. Again, regulation of the behaviors and not focusing on the cognition part could increase the occurrence rate of relapse. With target focused approach, we could increase the motivation. Adolescents and children has low motivation. Mostly increasing self-awareness is really important. Interview techniques should be used as well. In Greenfield, that's a technology, that's a psychologist of digital addiction focus in the study. In his studies, a treatment model was created and primarily cooperation with the patient and motivation increase. Interviews are going on in this model and then starting the treatment model, and in meetings about transforming that behavior will be planned later on. And we, for example, removing the device that has game installed in to be taken out from the room could be used, and triggers should be planned when and how that individual access that kind of device, and emotional triggers like free time, after hours, after school. With this treatment plan, we could maybe focus on focused direction and alternative thinking generation methods. Afterwards, in real life, we could have some supportive actions that could replace that award coming from the internet, could be defined like support social activities, and afterwards relapse prevention, awareness raising, and balanced usage will come make this model come to an end. This In this presentation, 12 studies were evaluated, and MDTs showed that the gaming addiction decreases the depression symptoms and ability. It is more effective in children than adults and than adolescents. We have 5 umbrella review results also that is actually assessing 5 studies. Besides decreasing symptoms, it also has a decrease in depression and anxiety. One of the most important treatment is BDT for this kind of a case. CBT-based interventions, again in other treatment models, we have add supportive treatment models like ACRIP. We have pathological internet use model could be harmonized with 10 adolescents. It has 8-module program like self-awareness, self-acceptance, and regulation kind of developmental rehabilitation program. And ACREP in adolescents was used to decrease this kind of disruptions, and it is seen as an effective program. Dialectical behavioral therapy is again in order to treat the problems of mood disruptions and impulsive behaviors. Digital addiction, we don't have much studies about this dialectical behavioral therapy. There are very little results, and the conclusions were actually not significant. When we check out family-based interventions, of course, parents are really important, and they are important preventive factors. A healthy family structure could decrease the digital usage addiction behavior. Not, it's also focused on emphasizing the relationship between the family. Again, we have to provide psycho education to the parents and reducing family conflicts, establishing consistent and age appropriate screen limits, and increasing parental awareness and role modeling could be preferred in PPTEC program. It is actually developed for adolescents aged 12 to 18 of ages. Families are also included in the therapy program. It gives precedence to strengthening family relationships. This is also people that can CBT program comparison. Both programs are actually effective results that is decreasing the addictive behavior and enhancement in the parental relationships. Again, in the PMTG program, it is created for parent management training for gaming addiction. It was an 8-week structured group program for parents of adolescents with problematic gaming. It includes psychoeducation, boundary setting, and emotional coaching strategies. The parents that is included in this program, internet gaming symptoms were decreased, school-based intervention, school access. School is accessible and it has a reasonable cost. It could be integrated into the health system, and preventive actions wise it could be effective. We have problem solving, emotional regulation, media literacy, educations could be provided. The professionals and families attendance is advised. Protect program is really important, and focusing on high risk adolescents age 12 to 18 years old. It's created in Germany, and here Protect program also has a control group. It is compared with the focus group, and it consists of a motivational interviews, and it is focusing on developing social skills and decreasing anxiety by providing anxiety control, and social skills training is also provided. Depression and anxiety symptom decrease is focused in this study, and functionality in school has been increased in the focus group. It is again focusing on primary school students called BST. It's curriculum based program, and with this program again raising awareness about risk behaviors, emotional regulation development, and peer communication and social skill development were focused. Again, in this group, it was elementary school level in order to prevent the risky behavior. When we check out the other intervention methods, physical exercises are actually majorly studied area, cognitive functions, and it's not pharmacological and easily accessible method. We have a meta-analysis here. We have the 9 randomized control study consists of 2,400 individuals. It again showed significant decrease in internet addiction. Again, here between sport effect rate is coming from tennis and badminton kind paired support kinds. It is applicable and it has low expense rate. Again, in the recent area, we have digital detox programs. Here, it is focused on temporarily cutting off all the access to the digital channels and devices of the individual. In order to decrease the internet usage, we have a structured framework. In this summary, we have digital detox practices that is focusing on cutting off all the access of the individuals to the social media. So results were actually not consistent. Some of the individuals are shown a recovery and decreased screen time, and some of them had no effect, and they got FOMO. In digital detox programs has effects on mental health, and this study reveals that in depressive symptoms had significant decrease with that problem. In conclusion, digital addiction has many factors, and effective interventions are CBT, parent and school-based interventions, and it could be used in combination, which is more effective. Parents and schools should be included in these treatment plans. It has longer positive effect. Again, using motivational interviewing techniques and assessment readiness for change is important here. Digital maintenance is unrealistic because we are living in a digital era, but we should use it mindfully and more appropriately. Thank you.